Hello, this is Beth here, lead nurse educator at International RN. So I'm an experienced nurse here in the UK, and I have been teaching OSCE and doing overseas recruitment of overseas nurses for about 60 years. I also teach the CBT exam. In 2024 is when I made my own company of International RN. If you'd be interested in taking a course with us, please check out our website. Or if you want more tips and other videos for your OSCE exam or CBT exam, please check out our social media and YouTube channel. Okay, and as always, good luck with your exam. Hello, so in this video, we're going to go through the evaluation station for the OSCE exam. So this is 8 minutes, and this station is exactly the same, has exactly the same marking criteria for all fields of nursing. So whether you're doing paediatric, general or mental health, all of them, it's all the same. So please stick with this video. Okay, so what to expect from this station. So you will be following through the same patient that you've had for the assessment, care plan and implementation. It will be the same one. You will be given a document. I will show you the one from the general nursing exam on the screen. On the front side of that, you're going to have a little update of the patient. And it might say some vital signs, particularly for general nursing and paediatric. And it will say what the handover is for, if it's to another team or if it's to the next shift. On the next page, is a section where you can write notes. So this is not marked, okay? So obviously use this if you feel it's needed. If you need to make notes, that's absolutely fine. But remember, it is not marked and you only have 8 minutes. So it is quite tight. So do not be spending 6 minutes, for example, filling that out, okay? Now, important thing to note about this station is it is a handover. But as always with the OSCE, it is a bit different. So what I would class as a good handover in my workplace that gives the next nurse all the information she needs to know is not going to pass you in the exam, okay? So you really, really need to look at the marking criteria for this one, and we're going to go through it together. But yeah, it's not like any handover you've done before, so please look at that. It is set out in the S-bar fashion, which is situation, background, assessment, recommendation. And this tool, we do use it in the hospital to kind of like escalate things like patients who are critically unwell to the doctor and that kind of thing. But it's set out a little bit differently in the marking criteria. So please have a look at that, just so you know, really. So your examiner will be acting as the person you're handing over to, and whether you need to do a handover to the next shift or a referral to the doctor or a referral to another team, it is all laid out in the same way and they all need to be done exactly the same. You might be including things that you don't think is relevant for a referral to another team. That doesn't matter. It is in the marking criteria and that is what you need to know to pass. Okay, so let's have a look at that marking criteria together. So introduce yourself and clinical setting. So the clinical setting is going to be the one you've had throughout your scenario. Also for this station, I forgot to mention, you will have back all of your documents you've used so far in the API. So your assessment document, like if you did an OBS chart, your care plan, your medication, all of those papers will be given back to you. So you can look through them. You don't need to remember. Okay, then you need to state the patient's name, hospital number and date of birth and location. So you just can read those out. You don't need to memorize them. Okay, next point is states the reason for handover. So that will be given on the front of your chart. If there's not one, it will just say it's for the next shift. So to take over from me will be the reason. And then we will move on to the background section. Okay, so the next point states date of admission, so that's normally today. Anyway, you will know it from the scenario, and the reason for the admission or a referral originally. You will know all of that, but again, you will have that assessment document given back to you, so you can have a read through that if you do need a little reminder. Okay, next it says notes, past medical history and relevant medication or social history. So you can just run through that from that initial assessment document. Again, you don't have to remember it. It says gives details of current events and findings from the assessment. So you would have done the vital signs. Also, they will give you an updated vital signs. This is for general and paediatric nurses only. So if there's anything abnormal there, I would highlight it. For mental health, you would have done the PHQ. So mention that result, and then whatever it said on those little updates throughout the patient's journey, you just need to mention there. So sometime we will have the patient's gone to theatre, or they've undergone some scans or something like that. And this links into the next box, which is the assessment, really well. So it says, states most recent observations, any results for assessments undertaken, and any changes that have occurred. So just the same if you haven't mentioned any of those. Next point, identify nurses' needs. So in our care plan, I know you would have written about 2 nursing needs. So of course mention those, but there's probably more things as well that you didn't have a chance to write about in the care plan. So mention all of them. Remember, the handover is as the patient as a whole, not just those bits you've written about. If this was a patient in real life, you would have gone on and done those other care plans on those other things. Next one, it says states nursing and medical interventions completed. So any of those little updates, like I just said, any medications you've given, anything like that. States areas of concern. So obviously, if there's something wrong with the vital signs, mental health patients, you might have like a suicide risk patient, that kind of thing. All of those you need to mention, obviously, to the next person. Okay, so for the recommendation box, it says states what is required of the person who's receiving the handover and give a realistic plan of action. So anything they need to be aware of or need to do. If there isn't anything pressing, you can say just to continue, but obviously highlight any concerns that you do have. And then for the overall marking criteria, obviously communication is complete, clear and appropriate. It's pretty straightforward. Systematic and structured approaches given to the handover, so you will be following hopefully this marking criteria, so that will be your structure to it, and then acts accordingly with the NMC code, so that's easy. And that is it for your handover. For your evaluation station, I'm sorry I have been looking at the screen because I just want to make sure I've read out all the points correctly to you, and as always, good luck with your exam.